Welcome to More Than Miles, where we use storytelling and expert interviews to empower endurance athletes and healthcare providers. I'm Dr. Kate Mihivik-Edwards, physical therapist, author, educator, entrepreneur, and former endurance athlete.
And I'm Dr. Kacy, physical therapist, runner, and triathlete, and together we're your co-hosts. Our goal is to always keep our athletes healthy on and off the road, because we know that our athletes are so much more than their body and their sport. We're glad you're on this journey with us. Now let's get to the show. Today we're going to be talking about running medicine, why running medicine is important, the why behind precision performance in physical therapy, which is the clinic where both Kate and I work. So we're going to start out by getting the origin story of precision and why Kate created this wonderful environment that we get to work in.
Thanks, Kacy. I'm just glad you're here.
Oh, I'm so glad to be here.
We're both, if you don't know, we're both jacked up on coffee right now, sitting on our treatment stools, getting ready to do this podcast because we're so not used to sitting down that we have to sit on our treatment stools.
Yeah, I tried a regular chair. It did not work for me. I could not think. So I'm feeling much better in my element. I'm ready to go.
That's right. A little bit of background, I guess. First, what is running medicine? Is that what you were asking?
Yeah, I think that's a great place to start because I feel like it's a niche in healthcare, and a lot of times we don't get this very sort of specific care for our runners, and sometimes it leads to a little bit of mismanagement within the healthcare system.
I completely agree. We began, I think this company is 5 or 6 years old. I never can remember what year I started it. I couldn't remember the year after I started it, so that's fine. But I was a runner and triathlete for a really long time, and I remember the reason I became a physical therapist was because I kept getting injured as a runner. And every time I went to PT, I was like, oh God, I hate PT. Why am I doing this? I don't want to do my exercises. There were always multiple people around. But eventually I fell in love with it and went to PT school. And then what I was finding in practice after I practiced at a couple different places was that everybody always looked at the runner like the crazy person in the room. And I was a runner in the clinic, so everyone would say, Kate, you take this person because they're crazy and you know how to deal with them.
It's not that it wasn't true, right?
I mean, it depends on what kind of crazy you want, right? I'm totally aware that I'm a little crazy, aren't we all? But I just never really loved the term, that person is crazy or they're a runner, so, you know, they don't require X, Y, and Z, or maybe they shouldn't come to PT because they won't listen. Everyone always said that runners don't listen to what you say, so why would you tell them to do something anyway? And therein lies the problem. I think that there's something in the healthcare system and something in physical therapy practices or physician's office that's wrong about that.
Yeah, it's a stigma, right, at the end of the day.
Yeah. Running medicine is essentially a subset of medicine where the people, hopefully, practicing in that area are really, really aware of what it is like to be a runner, the emotional components, the mental components, what it goes into to train, how the body works, the biomechanics behind it. They really have this huge amount of knowledge about running. And since this podcast is about endurance sports as well, it's the same thing for triathlon and other sports. You really want to see a practitioner that understands the sport that you do. And we didn't have that, and I didn't see that in many clinics. So amongst other reasons, I broke away from the clinic that I was at, and I started a practice, Precision Performance and Physical Therapy, that focused completely on runners, triathletes, and really what their needs were.
Right, yeah. And I think that your beginnings as a physical therapist and working in other practices is a big part of what precision looks like now and the way it's structured. So can you speak a little bit to that?
Yeah, sure. Of course. We see one patient an hour, which is not new. There are a lot of practices out there that do that, and it's a cash-based practice. We don't take insurance, but you can file for insurance. And we look at every patient holistically. And I know holistically is one of those words that is thrown around a lot, but I don't think it's necessarily true that it happens. But when a person comes in, we really listen to their story. And I think that you can learn so much from their story in the subjective exam more than anything else. And so we really figure out who this person is, what their goals are, what they want to do for their running or their race or whatever it is. Maybe they just want to run 1 mile. It doesn't have to be an elite runner or an elite endurance athlete. Maybe they just want to run a mile, but we really look at that story. And then we go ahead and look at them objectively. So that means we look at their shoes. We look at how they run on the treadmill. We look at their training schedule. We talk to their coaches. We talk to their dietitian if they have one. We talk to everybody kind of on their team. And then everyone laughs, but we usually end up being the head of that team because it's easy to coordinate through. It's easy for us to kind of coordinate all those pieces. So that's from the patient's perspective. And I think that, from the very first time they come in to the last, their last appointment, we really do take them on and look at them as this whole person. What do they do for a living? What do they do? How's their family? And they become part of our family. And then in terms of the office environment and what we do here is I think the same thing, right? We're kind of a big family. And I keep saying that word, but it's true. And we joke around a lot, and probably inappropriately sometimes, but that's the fun of it.
Sometimes I can be found running around in a T-Rex costume in the office.
Oh my gosh. The first time you did that, I remember you came and knocked on the door. Kate, is it appropriate for me to dress in a T-Rex costume in the office? And I thought, why not?
I know. I was like, I'd always known that this is where I wanted to work, but that was like the moment I really knew that I'm in the right place. And I had to. It was my patient's birthday. I had to greet them in a T-Rex costume. What else do you do on someone's birthday?
That was pretty amazing, actually.
It was great. It was very fun.
It was fun. I think that the other component about working here, and of course, Kacy, you can speak to it more fully in a moment, but what I wanted to do was create an environment where all of us felt like we could take care of ourselves. In our practice, or in our field, physical therapists get burnt out all the time. They see a ton of patients every week, and they're just constantly doing notes and expected to do more and more and more and more. And there's a limit to that. I was in a practice where I was burnt out. It was full of perfectionism. It was, dog eat dog. If you didn't have enough patients, you wouldn't get paid enough. And it was just not a really good environment. It wasn't an environment you could be your best at. And so I wanted to change that. So here, everybody works 4 days a week, and it's not really long, like 10 or 12-hour days. It's actually 4 days a week, so that we have that fifth day to take care of ourselves. And we really do talk and support each other in every way possible. And I think that even in our staff meetings, we make sure that there's always open communication, because if we can't take care of ourselves, we can't take care of patients.
Absolutely. And I felt this a lot in my first years of practice too, where every day felt like this grind, and 2 days was not enough to recover. It wasn't enough time to get all my notes done. It ended up being much more than a 40-hour work week at that point, right? And coming here and realizing that, being able to deal with these complex cases and be the physical therapist I wanted to be, I had to have that extra time for myself. And I think that's something that's overlooked a lot in healthcare, because we think we can just keep pushing, but there's a bandwidth there. There's a limit. And it's just that capacity to take care of yourself just does not exist, unfortunately, in most workplace models. And this isn't only a problem in physical therapy, right? This is a problem with a lot of how we look at our work week and how we look at our lives, really. But it makes a really big difference. And I find myself, feeling a lot more tapped into my patients and being able to take on a lot more of an emotional load when I have that time for myself. And so that was a really big bonus for me to come and work here.
Yeah, and I think that having a 4-day work week, for me, that was something exciting, something I thought everybody would love. And you said to me the other day that that's something you love about it, but it isn't for everybody. Some people would rather work 80 hours and make a little bit more money, and that's fine. But I certainly think that if you're working 80 hours, it makes it harder to see your patients for who they really are, and it makes it more difficult for you to really invest in that patient as much as we're able to invest in our patients here.
Right. And that's one of the expectations I think we have here with, we're going to head this team, right? We're your physical therapist, but we're on your team. And so if there's a certain aspect of your care that we can't take care of, we're going to find the person who can. And that's just something you just can't do if you're too busy and too stressed out and feeling sort of low yourself. And so it really lends that value to our care, I think.
Yeah, I think you're right. And I love that you're talking about the team again a little bit. And I just want to say that there's so many wonderful physicians and coaches and strength coaches that we work with all the time. And we couldn't be what we are, and we couldn't do as good of a job if it weren't for them. So I'm really grateful to all of the people that we work with on a regular basis.
Yeah, for sure. And it really helps coordinate that care and for everyone to be on the same page. It just results in everyone feeling better. The patient doesn't feel tossed around. It just makes a really big difference. So when you walk into our clinic, it feels different than most clinics, right?
Yeah.
So I remember I was a physical therapy student. Kate was my professor, and I came in to observe her treat because I was low-key stalking her because I really wanted to work here. So I came in to observe one day, and you walk in and it just does not feel like a medical facility. It feels like this combination of somewhere where you would get like a really nice like therapy session and a massage and physical therapy all at the same time. Which is kind of what, I mean, it's not too far off from what we do, right?
Yeah.
But it just has this feeling where, you know, we have like wood paneling on our doors and there's like...
Hold on, not 1980s wood paneling.
Not wood paneling. No, paneling is not the right word.
Reclaimed wood wall.
It's reclaimed wood. Yes, I actually should not be talking about the specifications of this. The bottom line of what I wanted to talk about was when I first walked in and observed how it felt in here, I was like, wow, this is somewhere where you can get better. Like you walk in and you just have that feeling like, okay, this is it. This is where I'm going to feel better. And it just has this very good environment for that. And that's really important.
I think so too. And I think we can take that back to the running medicine component of this discussion. When you're a runner who's injured or an endurance athlete that's injured, the last thing you want is to go to a sterile facility where people think you're a crazy person, right? How can you get better in that kind of environment, right? Mm-hmm. So I think the idea behind what everything looks like is you walk in and you're immediately dropped to an octane, if you will. Because most of us, let's be real here. That's all we can be. I'm sure we're going to say bad things on this podcast. There's no doubt. I might have a potty mouth, but I'm going to try my best. But we're all considered type A personalities, right? How many times have you heard that, oh, you're a type A personality, Kate or Kacy, and that's why you do X, Y, Z? And it's true. I think people who do endurance sports have to have that kind of a personality in order to stick to their schedules, in order to be as driven to run, 10, 15, 50 miles, whatever it is. So I think coming into an environment where you can just drop an octane really helps with that whole piece of getting treated as an endurance athlete.
Yeah, absolutely. Because, sometimes I'll be taking someone's history and they'll be talking about their training and you can just hear the cadence of their voice speed up and they feel like it's not relevant and that they're sounding crazy. And I just like, hold on. And I stop and I smile at them and I say, I get it. I get it. And you can see it. It's like visible how that just calms them down and gets them to actually give me all the information that I need. Because, as endurance athletes, we're aware of the stigma. We're aware that most of our family members think that we're crazy. And that's just the last thing that we want when we're looking for help, right?
That's exactly right. Because if you can't be validated for what you're doing or for your injury, then you really don't ever get the chance to start the healing process. And I know that there are people out there who will say, so what, you can't run 5 miles? So what, you can't run a mile? What's the big deal? Your knee hurts. Just stop running. And what do you say to that, Kacy? I mean, that to me makes me so furious. I want to scream.
Yes, it is so frustrating because there's just so much more than meets the eye, right? That this is part of our lifestyle, how we decide what we eat, how we get up, like what we do with the rest of our lives. And so when that's gone, it has a huge impact. And if you're not able to grasp that impact as a healthcare provider, you're going to miss something with your patient's care. Mm-hmm. And that's a great segue because that's what I wanted to talk about. So you always talk about, you want to look at athletes through a wider lens. Yeah. And what does that mean for you?
Oh, that's a great question. Yeah. Looking at athletes through a wider lens means looking at everything that's involved. And the thing is I lost the ability to run because of a cardiac condition. And I know we'll talk about that at some point, but looking at a wider lens means looking at how they're living, how they're sleeping, what they're eating, what their emotional health is like. Are they happy in their job? Are they not happy in their job? Knowing that they have this identity around their sport that really can be everything. So for me, my identity was my sport. So when I lost it, I didn't know what to eat. I didn't know what to wear. I didn't have anybody to talk to because all of my friends were runners or triathletes training for some kind of race. And I just was absolutely lost. And for me, looking through a wider lens means capturing that. It's not someone that just can't run a mile. It's somebody that's lost their support system. It's somebody that has lost their drive or their motivation to do X, Y, and Z. Maybe they've lost their only outlet for stress. What if they're a mom and they have 4 kids, which by the way terrifies me, and I think anyone who does, it's amazing. They only have 1. But what if they have 4 kids and their only outlet was to go for a run and now they can't? Or maybe they have a very stressful job and they're always traveling, not pandemic times, and their only outlet was to run and now they can't. So that impacts every part of their life. So looking through that wider lens means capturing that and looking at them for who they really are.
Yeah, absolutely. And that's the piece that I gathered when I was, sitting in my Emory classroom so many years ago. And I was like, I've got to work here. Like, I've got to do that too. That's exactly in alignment with my values and how I like to approach my physical therapy practice. And I think the pandemic is actually a pretty little microcosm of this phenomenon, because we look at so many things are out of our control right now, and we're losing so many things that we'd always just assumed would be there. And, running for a lot of us has been something that it's a constant, it's something we can always do. We have control over it for the most part. And so it kind of hangs it's that balancing act. And I feel like for a lot of us, when we lose that key element, the tower just topples over.
Yeah.
And, it affects so many different areas of life, and it affects mental health, emotional health, job performance, family life. It can affect everything, because that is that great equalizer for a lot of us. And everyone has an equalizer, right? But for us, it happens to be running long distances.
So in running medicine, looking through the wider lens is that much more important. Running medicine or endurance medicine. And, with our clients, that sense of looking at all that, they don't necessarily know that that's what we're doing, but they automatically calm down, settle in, and inevitably at the end of every conversation or every evaluation I have, I think this happens to you too, they say, wow, this is the best. You're the first person that's actually listened to me. That kills me, right? Just a little bit. How can we be the first person that's ever listened to them when they've probably seen 5 or 6 people before they've gotten here?
Yeah, I had the same exact situation yesterday, actually, with my new patient that I had seen. And it's at that point where you just have to stop and you have to talk to them and be like, this is the most important part of your care right here, is me listening to you. And I'm so sorry that you haven't had an experience like this. So it's not that this is so complicated that it's unsolvable. It's that no one really tried to solve the problem. And it's so frustrating, and you're so happy that they're here, but you just wish that they could get that earlier in this process and not have seen 5 people, right? I think the other big part of what we do here, because we think about running medicine, there's pieces of our care that are not necessarily present in traditional physical therapy care. And I think gait analysis is a big part of this, and looking at what actually happens when people run. So what does that look like? How does that correlate to how their body looks? I would love if you would talk about how you look at that and what role that plays in sort of the specificity of running medicine.
Sure. Gait analysis is very important for any runner. So if you imagine looking at somebody whose knees hurt, but never actually watching them do what they do to make it hurt, just doesn't make sense to me. And many people in places don't know how to do that, but there are a lot of people now and a lot of practices that do gait analysis. So it's not like we're the only ones. But When we do gait analysis, there are a couple things. If it's their first appointment, we usually take our subjective, get to know them, understand them, and then we put them on the treadmill. And once they're on the treadmill, we record what they're doing, and there's various ways to do it. You can put markers on the body. You can use, there's some great programs that you can use to do that, which is more like what we do, so you don't actually have to put the markers on. But we watch them run, we see what happens in their gait. They get off the treadmill, we look at it with them, and we break it down. And more often than not, you can see exactly why something hurts when you watch them run. We'll use knee pain, and I keep using this for an example because it's the most common running injury, and it's most running injuries happens at the knee. But when somebody lands during gait, you can often see in that stance leg, so the leg that's on the ground, what's happening in the knee. A lot of times that knee will be diving in or rotating in, or something will be happening at the foot or the hip. And seeing that in their running gait, you can tell, okay, this probably needs to be strengthened. This probably needs to be mobilized. This probably needs to be changed a little bit. Or, hey, they look great. There's nothing really going on here. Maybe it's something else. So it's just another tool for us to use, another objective measure that's specific to our running population. And it helps us break it down. And often we can see in their shoes, when we're looking before they get on the treadmill, we can see patterns in their shoes, either on the upper part of the shoe or the bottom, that indicate some gait anomaly or gait issue. And then when we get them on the treadmill, it's really fun. I play this game in my head. I wonder if the shoe really tells the real story. And I don't think I ever told you about that game in my head.
No, I do not play this game. Please enlighten me.
Well, I like to see if I'm right? So I look at the shoe.
That doesn't surprise me at all.
Why is that? You're gonna leave it? It's probably good. I still am your boss.
Uh-oh. Y'all, I'm getting to interview my boss right now. Not many people get this type of opportunity, so
I'm glad you want to interview me. But anyway, in terms of the running shoe, the running shoe often tells a story. I love it when runners bring in their running shoes and there's a big, huge hole in them because they haven't gotten a new pair in 3 years, which is not okay, by the way. But I like it because I feel like, wow, I can really make this huge impact. I can tell them to get a new pair of shoes and they'll be happy. But also the shoe tells a story of how they're landing a lot of times, or what they're not using, what they're using. And then when we get them on the treadmill, do the gait analysis, I look at that, the video, and compare that to the shoe, and compare that to their squat mechanics, their jumping mechanics, how their spine moves, what their thoracic spine is doing, how they're breathing. So we put it all together in this nice little package.
Yeah. I know another game that you play, which is closing your eyes and listening to what the running gait sounds like on the treadmill, which I have also started doing.
That's good.
And sometimes you'll play it back for the patient. You'll be like, oh, did you hear that? And they're like, no, I don't hear that. And it's okay because, I'm the one who needs to know what's going on, right? It's okay if they don't pick up on these little subtleties. But I just want you to know that now I'm also closing my eyes when I do a gait analysis as well.
Oh, I love it. So, you can hear a lot. And again, this is another tricky thing that I don't know if people teach, but I did used to play the game where I'd be walking down the hall and I would hear someone else doing a gait analysis and I would try to guess the injury in my head based on how the landing pattern sounded. And a lot of times it was shocking how right I was.
So the whole right thing coming back, I see.
But I did have some massive failures, like completely wrong injury. But yeah, that is a game that we can play. And I do think that the more you do gait analysis, those little things happen because it's just pattern recognition over and over. And it's like seeing so many people, seeing so many foot strikes, and you can hear it. And once you kind of build those patterns, you become better at picking up these things. And listen, the technology is amazing. We use technology all the time to do these, to capture the gait analysis. But using that technology and then also having the reps and having the pattern recognition on top of it, I think is what makes us special. It's, anybody can take a video of you and tell you what the angles are, but we take it much further than that. And we look at it to, if somebody comes in and they only get pain at 20 miles, we tell them to run 20 miles before they come, right? Let's get down to the problem. Yeah.
Yeah, absolutely. And I think just this fact that this is what we do all day, every day, we get that, like you said, that repetition, the pattern recognition, and that helps us really hone in on the root cause of an issue faster, right? And then I think the other piece of this is like, okay, so you have this information. What do you do with it as a physical therapist?
Oh, yeah.
Because there's things that we can change, there's things that we can't change, there's things that we should change, and things that we shouldn't change. Mm-hmm. So we need to know, like, okay, is this, like we said, strength and mobility? And, even if you tell someone, hey, I want you to run differently and give them some sort of cue, maybe they can't incorporate it because of the state of their body, right? We have to make some sort of change so that they can actually incorporate that while they're running and they have the range of motion and the strength to do so. And then there's other times where we can have really simple fixes in terms of cadence cues, arm swing, really simple things where a runner doesn't have to obsess about every footfall, but it can make a huge difference. And so being able to have so many reps and see this happen over and over again, I think that really can help us make small changes that are not as frustrating as what I think a lot of runners think about when they think about changing their running gait.
And I think that you actually bring up a good point. Physical therapy can be very frustrating. You can get too many exercises, feel like you're not being heard, be asked to do things that make no sense to you and you don't know why. So I think the other thing that is important, and that what we do well here, is we actually make it fun, I think. We'll see if my patients agree, but we make it fun. We always give them the why, always. Why are we doing this? We're doing this because this leads to this, or X leads to Y. And that helps with the buy-in. That helps people really understand, okay, so we're not just randomly doing this breathing exercise that makes no freaking sense and it's so boring we're going to die. It's a breathing exercise so that my pelvic floor is working better, so that my deep core is improving, and so I can have better posture while I'm running and my back doesn't hurt, right? So I think that that is the other piece of it. The other thing I wanted to say is a lot of, I can't remember the exact research on this, and I'm probably going to botch it, so nobody hold me to numbers. I want to say never hold me to numbers, ever, ever, ever. But there was a research article I read recently that I think only 25% of injured runners actually go in for help, which was mind-blowing to me, but I can see why that happens.
Yeah. And that's like, we've always looked at the research of what's the percentage of runners who get injured every year. And it's this crazy wide range because people aren't looking for help. They're not being reported. There's just no way to gauge what that actual number is. And I think a lot of us have this very loose definition of what a running injury is in the first place. And a very common misconception I see is, sometimes it's like, I'll take one day off and see how I feel. Most often. Sometimes people will be like, I'll just take a week off, which a little more reasonable, but there's a reason why that running injury is happening. There's a reason why you're having pain where you are. And so if we don't get to why is this happening and we don't fix that or we don't address it, this is something that's going to come back, maybe not in the same injury, but maybe in a different injury related to the same issue. So it can be both a preventative thing and then also actually getting the care you need so that this resolves quicker.
Yes, and I think that the sooner you come in, I usually say if something hurts more than 7 to 10 days, it's probably a good time to reach out to somebody that you trust. And the sooner people come in, the less time they have to spend here. The person that injures their knee last week and comes to physical therapy usually isn't here very long. The person who injured their knee last year and ran a little bit, took a couple months off, ran again, took a couple months off, decided to not really train and run a marathon, took some time off because they couldn't walk, and then comes in is a much bigger challenge. And then it's a bigger, it really is a bigger commitment to come in. So I think that's the other thing is if we can communicate to people, just come in. It doesn't have to be here. It can be anywhere you trust, right? Come in and see what's going on so that you don't have to be here. Because we don't actually want you to be here. We want you out on the road running.
Exactly. Yeah. It is no fun to come into physical therapy and having to spend, time, away from your sport, right?
Hold on. I do want to correct you. It is fun.
It is fun. I keep it really fun too.
But I get the point that you're not. You don't want to take time off from your life.
You go and greet your patient. Hey, how are you? And they're probably not running, and it takes a big loss. It takes a big hit to the rest of the rhythm of their life. And I'd much rather say like, hey, I'll see you at the race this weekend than to see them in the clinic with me. Although we do have fun. You're 100% right about that. Especially me, because I feel like I'm pretty funny.
Yeah, you're probably the funniest one here. I mean, it's true. I said it.
Wow,
it's on a podcast, so now it must be true.
It exists. Yes. Dr. Kacy Sinders, physical therapist, doctor of physical therapy, is the funniest physical therapist at Precision Performance and Physical Therapy.
That's a lot of words, and you heard it here first.
Yes, you all heard it here first.
So is there anything else that you really feel like people should know about either running medicine or this practice or any of that? Because this podcast is for healthcare providers and runners. I think it's important to say that because a lot of us listening as physical therapists think, oh, wow, I can work in a place like that, or wow, this is something I can actually do. And then runners say, oh my gosh, people listen to me and they watch me run. So is there anything else you feel like we should say or they should know before we sign off?
Before we sign off. Ooh, I like that word. I think the really important message here is that there's different types of physical therapy, even in the orthopedic world, and it's going to look different. And people's needs are going to vary depending on their goals, depending on their activities, depending on what they want to be able to do. And I love the physical therapy profession for a reason, because we're all about like, yes, we can do something about this, and we have a great exercise for this, and we're always about finding these solutions. And I feel like, because we see a lot of people who feel somewhat hopeless or feel somewhat like there's nothing they can do because something's been going on so long. And so whenever I look at my schedule and I see I have a new patient, I'm like, I get to give someone hope today. Like, I get so excited for that. And most of my patients know if they happen to be my end of my day and they're a new patient, I'm probably going to keep them here forever. They usually don't mind.
You shouldn't say that out loud.
I know, I shouldn't. It's like everyone's going to be like, I want that 6 o'clock spot. But no, it gets me excited because, meeting someone new and getting to the root of this is like what really brings me joy and was why I love being a physical therapist. And so I just want to be clear that the physical therapy profession as a whole does a great job and is a really important aspect of healthcare. We just are talking about our little corner of physical therapy, right?
Yeah, and there's a lot of good physical therapists out there, and I love to hear what they're doing and how they're changing the world and how they're helping people. But this is just kind of our little corner of the world.
Yeah, and it's awesome.
It is awesome.
It is awesome.
I mean, we're doing a podcast.
We are. My dream is coming true today. It's a really big day for Dr. Kacy because it has been my dream to be on a podcast, which I did do earlier this year, but this feels like my first real podcast, and it feels really good.
I'm so glad to hear that. I just am impressed that we figured out how to use the mics.
And we got it to charge.
Oh yes, the charging was an issue, yeah. Right? All right. Well, I'm so excited to have this journey with you, be able to do this, and I wouldn't want to do it with anybody else, Kacy.
Yeah, same, Kate. I think this is going to be great for a lot of people, for sure.
Thank you for hanging out with us. We hope you enjoyed today's conversation. As if you can't tell, we absolutely love spreading knowledge about endurance athletes and their health.
Be sure to subscribe and rate the show on iTunes or whichever platform you happen to be listening in from. Also, share the show with your friends, running buddies, training partners, family, your dog, or scream it from the rooftops. Whatever works for you. See you soon!